So coming to a few numbers, to understand how things can go wrong. These are figures from the government of India, what's called as the maternal mortality rate. So the current maternal mortality rate is 274 per 100,000 deliveries, which means for every 100,000 deliveries, 274 women are actually going to lose their life in the process of pregnancy or childbirth. And this figure has come down drastically. At the time of independence, it was 2,000 on 100 to 100,000. 30 years later, it was 1,000. Today, it's 274. Compare it with the developed world, it's 10 per 100,000. So that means 260 women are losing their lives where it could have been saved. Of course, everybody can't be saved. Some things do go wrong, and we have to accept that. But the figure is 10 per 100,000, and ours is 274. So things do go wrong. No matter how good the obstetrician is, the human body is such that you cannot control every event. So choose a hospital which has an adult intensive care unit, not just a room, but a place that is run by intensive care specialists whose only job is to run an intensive care unit. They don't do anything else. So more experience, right kind of support. So an adult ICU is very important, because the 1 or 2% of mothers who need it, you do not want to be transported in the back of an ambulance in the middle of the night by a hospital saying, we don't have an ICU, the mother needs to be on a ventilator or whatever. So the ICU is very, very important. Similarly, postpartum hemorrhage, very common. It does happen, not very common, but common enough. It is one of the things that goes wrong at the time of delivery. Huge amount of blood is lost. You need the blood to be transfused to the mother ASAP. So you need a blood bank which is within the hospital. You cannot say, get a donor, go to Red Cross, bring the blood. That is not happening. You need to have a blood bank within the facility. Similarly, you also need an excellent radiology team. People who are going to be doing your ultrasound on a regular basis, who are competent, who know what they're doing, who can liaise with the obstetrician and advise accordingly. And along with the radiologist comes the equipment. So you need state-of-the-art ultrasound, MRI, CT scan. That all has to be available within the hospital. So coming to the baby, I don't know if you know that 10% of all deliveries, the baby needs some help, whether it's with breathing, suction, oxygen, ambu bag, whatever. So 10% is a huge number. So you need a trained person who will be attending the delivery. It's not just okay to be MD in pediatrics. There is a neonatal advanced life support training that every doctor has to go through, and that person has to retrain every 2 years. So big tertiary care private centers, we ensure that all our doctors are NALS trained and they are retrained as and when there is a requirement. Also, 10% of all deliveries are going to end up in preterm labor. It's not my figure, that is a standard international figure. 10% of mothers will deliver premature. So delivering premature means you need a proper neonatal intensive care unit, and you need neonatal intensivists like myself who will run that unit. Their main job is to look after neonatal ICU and provide a 24/7 cover. It doesn't matter if it's 3 o'clock in the morning or 12 o'clock in the afternoon. If the baby is of a certain prematurity or known problems, you need an expert person who will attend the delivery. And again, talking about mortality, they are hard figures. Neonatal mortality rate for our country today is 25 per 1,000. Out of every 1,000 babies that are born, 25 die. Those are hard figures from our country. And these have come down drastically from hundreds. There are still hundreds in some states, believe me, the data is all on the net. And the international developed country figure is less than 5 per 1,000. They are only losing the babies who are either extremely premature or who have severe congenital, either surgical also we are saving most of the babies, cardiac problems or structural brain malformations, etc. So a very small percentage, those are usually the babies who are not really salvageable. So most babies who are otherwise born okay should be saved. So you need preferably a level 3 unit, and again, no neonatologist is working alone. We have pediatric surgeon, we have cardiac surgeon, we have pediatric cardiologist, gastroenterologist. Everybody is there, and they are called into the loop as soon as there's a requirement. So it has to work as a multi-speciality support team. So those are the important things for the baby. So I conclude on that account that don't look just at the outside, look at the depth of the facility that the hospital is providing, and you'll find it fairly easy to choose it.